People with disabilities, 1 billion people, are already one of the most excluded groups in our society. Now, the UN says that they're also among the hardest hit group by COVID-19 with higher fatalities. People living with disabilities often need assistance from a loved one or a caretaker. Contact that safety measures such as social distancing make practically impossible. Hello, I am Auriane Itangishaka. Thank you for being with us. On today's program, we'll look at the challenges that people living with disabilities have during this pandemic, available resources or solutions, and success stories as well as innovations to support people in this community. Now first, in Ghana, women with disabilities who achieved a level of independence financially are now having to rely on family members for care and financial support due to COVID-19. I spoke with Veronica Kofiedu, the executive director of an NGO called WODAO. Herself an amputee, is helping people, women and children especially, with disabilities in the Ghana's northern Volta region.
Before the pandemic came, most of my women, their livelihood depending on crafts, empowering skills, economic skills that they have through the engagement of my organization. Majority of them do not have formal education, so most of them go into informal sector by learning some kind of trade that they can also depend on their livelihood. So before then, though things were not all that smooth, but it was better. They sew bags, doormats, and some are into hairdressing, and then tailoring, seamstressing. They make clothes. Some sells in small shops. Some have handicrafts that they used to sell to the public. Due to this pandemic, they've been restricted to their homes, and they don't have the means to go outside there to sell their goods. And community members, because of the quarantine, they find it difficult to go about their normal movement to purchase goods and services. So because of this, women, especially women with disabilities in Ghana, they can no longer sell their products. They can't even go out to do anything for themselves. Their caregivers as well are finding things very difficult. So supporting them nowadays is a bit challenging.
Now, Ms. Kofiedu, how is WODAO, your organization, trying to mitigate the impact of COVID on women with disabilities in your region, the Volta region, at the moment?
The pandemic actually had a toll on the organization itself as well, because we do not have donors or support, people who will really come in to support us due to the restrictions of funds. So the little that we are doing is we are calling them on phone, and with a little support from Voice Ghana, Voice of People with Disabilities. It's also an organization championing the cause of persons with disabilities in Ghana, in the region. We collaborate with them to get little assistance to visit our people in their communities, to engage them in the sensitization of the preventive measures of the pandemic, and also to send them some little relief items.
Now, moving forward, what is the main goal of your organization during this pandemic?
We used to engage resource persons to educate them on their reproductive health issues. For instance, on HIV/AIDS, on breast cancer and cervical cancer awareness, and also screening of their breasts, and also domestic violence, their human rights in connection to domestic violence, because as much as we are women, we face a lot of abuses, even from our caregivers, from people in the community. And then most of them don't know where to even report such cases. So we educate them, we try to sensitize them to know where to go when such cases happen, and also where to seek support. So we would like to continue those activities, empowerment activities, and also economic activities, things that will bring them money and to enable them to be totally dependent on their own, so take care of themselves. And also children, when it comes to children, their inclusion in the formal educational sector, we're also doing some work in that direction. But most of them are just at home because of superstitions. Families don't believe in even taking them to access healthcare in the hospitals. They put them in the rooms. They don't give them the chance to have their full participation in society. So we would like to continue moving forward.
A bit to the east, in Nigeria, disability advocates say nearly 20% of women that are living with the disability often face stigma and suffer injustice, including gender-based violence. From Abuja, Timothy Obwezu has a story of a disabled woman who is pushing back to ensure that women like herself have better access to healthcare and equal justice.
When Eberendu Onyinyechi was barely a year old, she was struck with an illness that paralyzed both her legs. Still, she got an education, earned a linguistic degree, and now works for the Abuja government. But Eberendu says Nigerian disabled women are subject to sexual violence.
Many times when some of us are in a relationship, these guys tend to take advantage of us. You know, I think sex is supposed to be something I consent to. You don't force me to do it. You don't try to use the strength of a man to try to take it. But unfortunately, that's what many of us suffer.
Women and girls with disabilities in Nigeria are 3 times more prone and vulnerable to gender-based violence than their able-bodied counterparts, according to a non-profit activist group. They also find it harder to seek justice because of stigma and bias due to their condition.
Most times they are not believed.
Irene Patrick of the Disability Rights Advocacy Center, or DRAC, is helping women and girls with disabilities get better access to justice.
Nobody believes that, oh, as a person, as a woman with a disability, you were raped, because of the societal notion that women with disabilities are not sexually attractive. So nobody can actually desire them enough to rape them. So we found that this is preventing them from getting access to justice, because not only do they not want to report anymore, even when they report, nothing is done about it, and in some cases they are actually ridiculed.
Nigeria signed its Disability Rights Act into law about a year ago, but activists say ignorance, lack of access, and poverty remain barriers to justice for Nigeria's disabled women. Emmanuel Adedeji of the Nigerian Bar Association pledged his group's support at a recent meeting.
I think this meeting will be an eye-opener to every one of us to know the provisions of the laws prohibiting discrimination against persons with disability, which was recently passed into law after several years of ratification by Nigeria. The Nigerian Bar Association will be willing afterwards from today to be part of any initiative to protect the rights of persons with disability.
Until matters improve for women with disabilities, organizations like DRAC say they will provide a safe place for them to fight for equal justice. Timothy Obwezu for VOA News, Abuja.
We have to take a quick break. When we come back, we'll look at some solutions to help to assist persons with disabilities during this pandemic. I speak to the African Youth with Disability Network in Sierra Leone. And on education, a Kenyan man who was born deaf has developed an online mobile application for sign language to help deaf children learn online during this COVID-19 pandemic. That's next. Stay with us.
We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the government to listen. It really was powerful because it showed what is possible when men and women band together and say, enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
Welcome back, you with our voices. In this segment of the program, we'll look at some solutions to mitigate the impact of COVID-19 on people living with disabilities. First, we go to Sierra Leone, where an NGO is working to sensitize people about the dangers of the pandemic. This group's director, Bakarr Bangura, tells us what they're doing from Freetown.
The impact of COVID-19 in our community is very, very negative because, as you know, people with disabilities are very poor, and you found out that most of them depend on the street for their living, they beg, and most of them are unemployed.
Now, what intervention and methods have you used to sensitize people of the impact and the dangers of COVID-19 in your community?
Well, honestly, we looking at the situation, found out that we are just going general as a nation, and there was no specific thoughts that there are certain categories of people with disabilities who cannot only depend on the use of hand washing. So we decided to see how much we can improvise or bring something different. That is the use of hand sanitizer, which is very, very important. As you are aware that most of us that are using devices, we cannot wash our devices whilst washing our hands. And if you are a blind person, for example, using the white skins, or you have somebody that is taking you along, that person cannot be washed or bathed, nor the white skin can be washed. So it is very, very difficult for people with disabilities.
Now, what comparison, if there's any, between COVID-19 and Ebola in the way NGOs and government have intervened to try to assist people with disabilities?
Yeah, and this is a very good question that you ask. If we can compare back during the fight against Ebola and the fight against COVID-19, fortunately for us, we had both experiences. And during the fight against Ebola, we had the resources at that time. And we were having even ministries, departments, and agencies giving us support as civil society organizations to reach out to those hard to reach areas, But if you compare that to now, we only centralize, the government centralize the resources. That is, they are only working with the government established structures. So most donors and even the MDAs are working directly, or even corporate institutions are working directly with the EOC, now the NACOVAC, to see how best they can fight COVID.
Any particular challenge that women faced during the lockdowns during COVID-19 in Sierra Leone?
As you are aware, most of them have children. When you look at, men do take advantage over them, impregnate them, leave them with children. They have lots of children, and they do have that education. They don't have that kind of business that they are doing. They depend on street begging with their children.
In the deaf and hard of hearing community in Kenya, a man who was born deaf has developed a mobile online learning application for sign language to help deaf and hard of hearing students during this pandemic. Victoria Amunga reports from Nairobi.
For 13-year-old deaf student Stephanie NJERI, remote learning during the COVID-19 pandemic could have been quite difficult. But thanks to the Kenya Sign Language KSL finger spelling application, she has been able to keep up with her studies.
It is easy for me when I am doing my homework and revision on my own. When my parents forget to finger spell, it helps to remind them.
NJERI'S parents help her study while the KSL finger spelling app helps them communicate.
During homework sessions, you'll find that there are things she wants me to assist, but if she tries to sign to me, I'm not able to comprehend exactly what she needs. So she'll open the app and she'll start showing me, this is what I need.
The application was developed during the pandemic by Hudson Asiema, who was himself born deaf, to help Kenya's 4,000 deaf school children with remote learning.
Because we didn't have a lot of these apps that are centered for children accessible offline. When you compare the same with the hearing kids, now they have a lot of apps that they can access for them to learn easy basics of language like alphabets.
The disability organization INABLE helped Asiema develop the app.
Where INABLE is coming in is to help develop this app, or to help link up the designer or the developer with the specialists from across the world, so that the app is enabled to have more features, to be more friendly even to the younger one.
Deaf community leaders in Kenya say the technology has improved learning among deaf students.
And it will sort out the issue of children staying at home and not learning sign language. And through this app, it's something which is very technical, because they'll have to use their phone. And it will be very helpful to the deaf.
While the app was designed for deaf students learning at home, students are finding it useful even after returning to school this month. Victoria Amunga for VOA News, Nairobi.
How about in literature? Well, in Mali, linguistic and Braille expert recently began the translation of the country's most widely spoken African language, Bambara, into Braille. Bambara is spoken and understood by about 15 million Malians, even more than the colonial French, making it an important step for blind people. Annie Reisenberg profiles a teacher of the new translation in this report from Bamako.
Musa Keita has been at the Malian Union of the Blind, UMAV, since his childhood, first as a student and now as a teacher. He is one of the 6 instructors who will soon teach Braille in Bambara, the country's most widely spoken language. Before now, students had only been taught Braille in Mali's colonial language, French.
When I think of this project that thought not just of the visually handicapped, but moreover that thought of Africans, particularly of Malians, to write Braille in their own language, to try and adapt Braille to Bambara, which isn't even the official language, really it's a feeling of pride and joy for us.
Donc vraiment c'est un sentiment de fierté et de joie pour nous.
If you can write and read in Bambara, then you can learn how to write it in French.
Abdoulaye Diallo is a blind physical therapist and a Braille specialist. He writes prescriptions and patient information on paper with a tool called a slate and stylus. The Braille is then translated into written French by clinic staff. Diallo says teaching Braille in Bambara is a breakthrough for students and blind adults who never had the chance to go to school.
If I'm an adult, illiterate, and I'm going to learn Bambara, but I can see, I learn Bambara, and I can do whatever I want. If I'm an adult, but I'm blind, and I don't know Bambara, I'm in the margins. So it's the Bambara which will save, which will give autonomy to all these people who were in the margins.
Isiaka Bello, a linguist expert at the University of Bamako, was contacted in 2019 by a nonprofit group called Sight Savers to spearhead the project to adapt Braille to Bambara. Bambara has more letters than the French alphabet and more intonation, so new letters had to be created, but only within the 6 points available in the Braille cell. Ballo says blind students in Mali will now have more access to education.
S'ils peuvent apprendre ces compétences dans leur langue, moi je pense que c'est...
If they can learn these subjects in their language, I think that will only strengthen the knowledge and mastery of science, the knowledge and mastery of literature, the knowledge about the world around us.
In many schools, instruction is done in the local language rather than French. Ballo says the next step is to translate Mali's other national languages, like Fulani and Songhoy, into Braille. Annie Reisenberg for VOA News, Bamako.
We have to take another quick break. When we return, we'll share with you some innovations to assist persons with disabilities. One is a clear mask for easier communication, facial expression, a gesture, or lip movement to send a kiss. That's next. Stay with us.
Like Voice of America on Facebook. Follow VOA on Twitter. Join VOA on our YouTube channel. Like, follow, join VOA.
Welcome back, you with our voices. What began worldwide as an essential item during the pandemic for deaf and hard of hearing people now became the latest must-have for some. VOA's Mariama Diallo reports on an Italian fashion company making see-through masks.
When the coronavirus hit Italy in March, Doriana Marini had a choice: shut down her factory of fashions or create something else to pitch in during the pandemic.
Anyone can use this device to have easier communication, not just with words, but also with gestures, facial expressions, lip movements, for example, to send a kiss.
Non solo verbale, ma anche, fatta di gesti, di espressioni del volto, di movimenti delle labbra, per esempio per potersi scambiare un bacio.
With stitching equipment ready to go, she designed her first washable medically certified surgical mask, which is also transparent. A transparent face mask is particularly important for persons who are deaf and need to read lips to communicate, but it's also important for businesses whose employees deal with the public.
We began with requests from specific entities, such as for deaf individuals, and now we sell it and receive orders from the most varied sectors, such as hotels, restaurants, schools, and also beauticians, hairdressers, anyone who needs to have a smile while at work.
Piuttosto che in ambito magari, non so, dell'estetista, dei parrucchieri, chiunque ha bisogno di far vedere il proprio sorriso mentre lavora.
Stylist Barbara Celli welcomes clients who've waited for months for a haircut.
Clients are coming back from a difficult time and are in need of a smile, so being able to show your mouth is very important.
E hanno bisogno del sorriso, quindi avere la bocca visibile è molto importante.
At Gelato shop Cremose, workers embracing the new look say it has improved customer relations.
These transparent masks are very important for us because in our job, the most important thing is a smile, first thing. A smile, and also to be able to quickly understand the customer and have them understand you too.
And a dental hygienist says the transparent mask helps her communicate important details with patients who are deaf or hard of hearing.
Especially in my job when I try to explain toothbrushing techniques, the patient relies also on watching lip movements.
Il paziente si avvale anche della possibilità di guardare appunto il movimento delle labbra.
These specialty made masks go for about $7 each. Mariama Diallo, VOA News.
As we wrap this week's show, we share with you a woman to watch. When Aissatou Balde lost her arm to cancer, she viewed her new reality not as a disability, but a problem that needed fixing. Alison Kogo Fernandez reports from Dakar, a story narrated by Carl Gunsberg.
In a suburb of Dakar, Aissatou Balde has an appointment with her team. A lawyer by training, the 30-something Senegalese woman has become an entrepreneur. Her focus for almost a year has been on a project particularly close to her heart. Balde's left arm was amputated below the elbow 3 years ago to treat cancer. Afterward, she considered an artificial limb, but the only kind available to her was purely cosmetic, not functional.
What I wanted was not a prosthesis to make myself beautiful or more beautiful, but something that allowed me to have a minimum of autonomy. A prosthesis that could allow me to prepare my own food, drive a car, play ball with my son. That's what I wanted.
Balde could not find an affordable bionic arm on the African market, so with her many contacts in the digital world, she formed a small team of enthusiasts to explore manufacturing prostheses through 3D printing.
When you place the sensor, you have a whole mass of data coming in. Now you have to be able to determine which of the data belongs to a specific muscle, to know if it is the finger that has been bent, the hand that closes. All this data must be sent to an interface. It is a whole network of neurons related to artificial intelligence.
The team has made a prototype which still needs further development. It was made through 3D printing.
3D printing gives us this possibility to create things cheaply and quickly.
The Washington-based Amputee Coalition says a prosthetic hand alone can cost thousands of dollars in the United States. With 3D printing, a simple one can be made for as little as $50.
When we say that the person has the right to education, health, I tell myself that this is the minimum that we can offer, the ability to live independently without needing too much assistance.
The team aims to set up a first model within a month, then improve it over time. Balde hopes to find investors so that working 3D limbs materialize as quickly as possible to benefit those in need. For Alison Lekogo Fernandez in Dakar, Carol Gunsberg, VOA News.
That's it for us this week. Until next time, have a great day.